So my first question is, would you mind sharing your mental health story with us and telling us a little bit about yourself?
So my name is Hiba. My mental health story, I guess, is a very integral part of myself, I would say. It started when I was very young. I remember being a very anxious child, but I was also a child with ADHD, was just undiagnosed for a long time. When I was around 12, I had my first depression, and that took me by surprise. I didn't really know what was happening to me, but I didn't really use the verbiage of depression, even though people did use it around me, because this was 2012. People were still using the word depression, but I just didn't understand enough to use that word. And I kept having the depression came and then it went away, and I kept having sort of these episodes of these depressive episodes, and I called them my ruts, because I didn't really know what to make of them, because I never thought I could be getting depressed. I really didn't think that. But when I was 17, I went through a phase that was in every way the opposite of a depression. I was so energetic. I was on top of the world. I wasn't sleeping. I wasn't eating. I was just so happy. That's the only way I can describe it. And so energetic. Which I now know was a manic episode, because I have bipolar disorder. Then I started rapid cycling between these episodes. So rapid cycling means that you have more than 4 more episodes in a year. So I would have more than 4. I would rapid cycle every 2 months, basically. Every month or 2 months, I was in a different phase. So it was very, very difficult. It was very strenuous, and it was during my first year of college, so it was very, very difficult. And in the first month of my sophomore year, I got diagnosed with bipolar disorder, and I got hospitalized at the same time. And I ended up taking a lot of time off school on recommendation from my psychiatrist. And I kind of I feel like looking back, I didn't really utilize the time as well as I could have, but I was also just coping with this huge diagnosis, so it makes sense. But in that year, I sort of was getting worse and worse somehow. I think it was the medications that I was on, it was just the psychiatrist that I was seeing, I was getting worse by a lot. Then I changed psychiatrists, and then I changed psychiatrists again, and then I got hospitalized for a second time about almost exactly a year later. And in my second hospitalization, I decided, things have to change. I just can't live like this anymore, because I had been living like that for so long, and it was exhausting to just live in this constant cycle of just up and down and up and down and up and down. And I was making so many impulsive decisions that were really impacting the people in my life, and it was impacting my own life. And I realized I just couldn't do this anymore. So I decided to take treatment more seriously, and I got lucky enough that I found the right medication soon after that, the right dosage. I found a really awesome doctor. I found a really awesome therapist, and so I got really lucky, and because without those people, I would not have really gone to the point in treatment where I am today. And it's been 3.5 years since then, since I've been stable, since I've been in remission. And actually, today I was just on the phone with my psychiatrist right before this, and I had called her earlier because I want to wean myself off my medication now. Not because medication, there's something wrong with it, but because I want to do trauma therapy, and apparently I've been told that trauma therapy is more effective when you're not on a high dose of an antipsychotic. So we'll see how that goes, but I'm excited that I'm at the point in my life where I can actually do that now.
Yeah, definitely. My next question is, what do you think are some ways the mental health care system can be improved based on your experience with it?
So the best and the most important thing I've learned in terms of choosing a mental health care provider is finding someone who will listen to you. I think so many psychiatrists and so many therapists out there believe that they are like the all-knowing expert, and like their client or their patient really doesn't know much. And I've seen this both from the professional side of things, being as someone who like has worked in the mental health field, and from being someone who is someone who's a patient themselves. And I feel like it's very tragic, because I really do feel like people are experts in their own experiences. People know what they're going through, and even if they don't have the verbiage in terms of like the medical verbiage to say it, they can express it. And I feel like patients and clients need to be listened to, and they need to be like an active part of their treatment. They need to feel like, like I'm part of this treatment, like someone's not just talking at me, like we're doing this together. And I'm like, if for example, for something that I really experienced in my first psychiatrist was like, I would tell her like, this medication is making me crazy, like I'm acting like I've never acted before. Like I remember I came into her office, I just chopped off my hair like with kitchen scissors like 2 hours before, and she was like, let's just go higher on the dose of the same exact medication. And I was like, what are you talking about? I'm telling you this medication isn't working for me. And what I learned from my best psychiatrist is anytime I'd come up with any concern, I remember like my concern the first time was as simple as like, I don't want to gain weight, so can I be on a weight neutral medication? She didn't force me to be on a medication that like would make me gain weight. She's like, okay, like this is a list of weight neutral medications. Is there any you would like, any that stand out to you? Like I'll tell you about them. And like that kind of like sort of back and forth where like you're part of the treatment, I feel like is very much valued.
Yes, definitely. I know finding like the right therapist and the right psychiatrist is a huge part of the field. My next question is, what are some of the most prevalent mental health misconceptions that you have encountered?
So I think the most prevalent misconception that I've seen around mental health is probably, I feel like people think that if you can present yourself as okay, which I've been able to do pretty well for even when I was at my worst, people think that what you're going through must not be that bad. And I feel like, some people have the ability to put on a front, myself included, and that doesn't mean like we're suffering any less. It just means that we know how to talk to people. And I think like that's a misconception I've seen. And then there's also the misconception specifically around bipolar, which I have, is a lot of people don't really understand what it is. I've heard people around me even like call people bipolar because they were rude or erratic, or people will sort of think that being bipolar means like you're happy 1 second and sad another second, and they don't understand that it's like literally like weeks to months. It's not like I'm just super happy like for a few minutes then I'm really sad. Like that's not what it is. So a lot of people don't really understand that, and like I think that used to really infuriate me before, but now I'm just hoping I can educate people as much as possible.
Definitely. And I know you just mentioned how some people like aren't aware of what certain mental health disorders are, so do you mind discussing exactly what ADHD, CPTSD, and bipolar disorder are?
Yes. So bipolar disorder is a mental health condition in which you suffer from episodes. So there's different types of bipolar. I'm going to speak about the one that I have, which is bipolar 1. In bipolar 1, you experience depressive episodes, hypomanic episodes, and manic episodes. Depressive episodes, I think most people know what it is. You're isolating, you're possibly eating a lot, or not eating, or most people know what depression is. With hypomanic, it's a step under mania, where like you're really happy, you're really excited, you're energetic. You're probably a little impulsive, but you're not like as impulsive, as intense as you are in mania. And mania is sort of the very extreme end of where you can go. And with mania can come other things too. Like you can have like psychotic features in your mania, which I do, in which you can have delusions and hallucinations, and they feel really real, obviously. And CPTSD is complex post-traumatic stress disorder, and it's a type of post-traumatic stress disorder where if you have PTSD, it's usually from like one event in your life. But CPTSD is often caused by a series of multiple events in your life that are really traumatic, or one event that lasted a long time. And most people's CPTSD does start in childhood, like mine did. The symptoms are that of PTSD a little bit, but they also overlap with other disorders a lot. And CPTSD symptoms are very much like they involve, I would say, like every aspect of your life, like of disassociation, interpersonal relationships, like every aspect of your life is affected by CPTSD. And then ADHD is, well, it's called attention deficit disorder, whatever, ADD, but it's more than that for sure, because I have ADHD, and I've realized that also affects every part of my life. No problem. I think we're safe. Okay. ADHD also, it's more than that, like it's also the ability to just like not have motivation to start things. It's hard to like function without structure. There's so many like aspects. So honestly, I don't think I can like explain ADHD in a way, because there's just so many aspects to it. It's not just like that hyperactivity and attention deficit. Like there's so many more things about it that I don't know, that people experience.
Yes, I'm sure it all impacts like almost every aspect of your life. My next question is there anything you'd like to say to anyone else who may be struggling with any mental health issues?
Yeah, so I think the thing that I like to say is like, basically, you can achieve any goal that you want, and it's gonna be harder for you. And that's something that like I didn't understand, and I feel like if I could go back and tell my like younger self anything, it would probably be that like you can get to where you want to go. Like I just got admitted into a doctor of psychology program, and I got there because I've worked hard the past few years, but also because even though things may be harder for me, that doesn't mean I'm not going to be able to make it, And I always like to say that's just going to mean that I'm going to be twice as proud when I get to my goal. So that's what I would like to tell people if they're struggling.
Yes, definitely. And congratulations on your achievement.
Thank you.
My next question is, what do you believe is the importance of psychoeducation among youth?
So it's very important. I would say, like, if I had known when I had been experiencing those depressive episodes that they were depressive episodes, I think, like, personally in my experience, I could have probably stopped things before they got to the point that they got to. Or even after my first manic episodes, if I had just realized, and obviously I couldn't have realized because at that point I didn't even understand what a manic episode was. But I think like education is so important because a lot of disorders and a lot of things for a lot of people start in their teenage years, because there's a lot of changes happening in both your life and your body in your teenage years. So it makes sense that a lot of disorders then would start there. And I think like if you have the proper vocabulary to express what's going on with you and tell a parent, tell a doctor, I think that's like, that would be so instrumental in like helping you get better.
Yes, absolutely. My next question is, have you encountered mental health stigma in society? And if so, how do you believe that this stigma can be countered?
So I honestly have encountered a lot of mental health stigma, but it's really weird because I find that like when I encounter stigma, it's usually not aimed at me. And this is something really interesting because, I can't remember I can't remember what it's called, but like there's like a principle in psychology, right, where like you see you see your friend or whoever it is as the exception to the rule if you have like biases. So it's like, you know what I'm talking about?
Yeah, like I understand what you're saying. Like it's like, oh, but you're different. Like even though like it's like, no, that's not what's happening.
Correct, right. So it's like people can have those biases in like say like race relations where like you might have some misconceptions of like, so say I'm like Pakistani, you might have some misconceptions about Pakistani people, but then you think like, oh, you know me, like I'm the exception. Like other Pakistani people might be like, you're the exception. It's the same thing with like mental health issues, because people I know have all sorts of ideas of like what a mentally ill person is like, and they'll kind of see me as the exception to the point where they feel safe enough to kind of say those like, I'm just to say misconceptions to me. They like feel comfortable enough just saying like, oh my god, that like my like, I remember this a very like specific example, but someone I was talking to one point was like, yeah, my boyfriend's mom is like crazy, I feel like she has bipolar or something. And I was like what, like why would you say that to me, you know? But yeah, I find that like the most stigma I see around me is usually directed at other people, because I feel like I said, like I present myself as very like normal, and especially since I've been in remission, I have been normal, and I'm using it in air quotes, not actually, but so it's hard for some people to be able to see kind of that I'm also part of the marginalized group of mentally ill people, and I struggle a lot, and I find that people feel comfortable saying sort of like really, I would say, disrespectful things, but even if they're not aimed at me, I sometimes still feel like they are, because if they're saying that about them, like I feel the same way because I have the same experiences.
Yes, definitely. And how do you think that this stigma should be combated or addressed in society?
So I think, and I really feel this, the best way to address stigma is through education. I really think that. I think if people were educated and kind of knew what they were talking about in terms of mental health issues, I don't think people would be so quick to stigmatize those mental health issues, because if you really understand it, you know, it's like, it's not a big bad monster if you understand it, you know, you get what symptoms are, you get what it is, you're not going to be so afraid of it. So I really feel like psychoeducation is the way.
Yes, definitely. And my next question is that, do you think there are cultural differences in how mental health is viewed and treated?
Definitely. So I can only speak to the cultures that I'm part of, which is like American culture and South Asian culture. But in South Asian culture, and actually it's funny because across the board, there is very much a lot of stigma, right, in both South Asian and American culture. But in American culture, it's like slightly more accepted to like go to therapy, especially within my generation, our generation. It's more accepted, you know, therapy is very normalized, and medication's also more normalized. But within South Asian culture, not at all. Like I find that like when people find out I'm on medication, it's like a bigger deal than it is in American culture. And I find that South Asian culture is more hush-hush about it. Like American culture, I find that it's a little bit easier to talk, especially around, I'm gonna like emphasize people my age. It's easier to talk about mental health issues around people my age. But the thing that I've learned from posting videos online and like having like a little bit of a following is that like most of my following is people of color, and most of my following is people of color, and they have similar experiences to me in that they also talk about how, you know, they can't talk about mental health issues with anyone else, and that's why they feel connected to my channel, because I'm someone who looks like them, who's talking about mental health issues, because it's just so unheard of to talk about. Yes,
definitely. And with that answer in mind, how do you think that we can address this to make sure that everyone, no matter their background, has access to mental health care and feels comfortable using these services?
So I think like an important part of that would be to have more psychiatrists and therapists and psychologists who are of different cultures, especially cultures that are underrepresented in mental health care. So I think like, for example, my culture, South Asian culture, is very much underrepresented in mental health care. I've been looking for a South Asian therapist for the past like 5 years, and I've yet to find one in South Florida. So I think like it's really important that we have people who look like us as an option for treatment. Like, not necessarily they're the only ones you're going to go to, but just like they're an option, and someone who looks like you is talking about it, I feel like that's going to make things easier and you're going to be more open to it. Because I think like without it, there can be sort of misconceptions that like, oh, like this is like mental health care is a thing that belongs to like this culture, or like if there's a language barrier which there is a lot for like other older generations, they're not able to access mental health care in the same way in this country, and it's not really an option in, you know, like my home country, Pakistan. Like mental health care is not really huge at all. So like over here, if they want to try to access it, they have that language barrier where they can't really get therapy to as much as benefit as they can, because they can't really, you know, there's a language barrier, like I said.
Yes, definitely. Having a more diverse mental health care field is very important.
Yeah, I agree.
Yeah. That was my last question, so thank you very much for your time. I really appreciate it.